Disc herniations are a very common diagnosis, and it's somewhat misunderstood. The analogy that I always use in the office is that the disc is very similar to a jelly donut. If you were to squash that jelly donut, some of that jelly leaks out. And in the spine, when the inner material of the disc leaks out, it can be very irritating to the nerves that are adjacent to that disc. The nerve that is being irritated provides tremendous pain into the affected extremity wherever it's heading into. And so treatments directed toward that include minimizing some of the inflammation that is a result of that disc or the jelly material being adjacent to the nerve. And surgical treatments can include going in there and not to disturb the rest of the jelly donut, but to clean out the portion that has leaked out, and then thereby relieving the inflammation or the irritation on the nerve. When I first see a patient in the office, their history is probably the most important thing. I probably get the best idea of what's going on based upon what the patient is telling me. So, for example, if they don't complain of any sort of pains going down into the arms or into the legs, that gives me a good idea that perhaps the nerves are not actually getting pinched or irritated, that perhaps it's more of a muscular disorder, muscle strains in the back or the neck. Perhaps it's more degenerative disc disease that's causing those pains. After the history, the physical exam also is very important to ensure that the neurological system in the body is working properly. It's important to make sure that the muscles are working, so we test particular muscle groups that are attributable to particular nerves. If those muscles are working, then it's a good bet that those nerves are in proper health and not getting pinched. We also check reflexes, and also to palpate or push on those affected areas to see if such actions actually aggravate their symptoms, and that can result in a better idea of what's going on as well. Finally, in addition to the extremities, there can be some disorders that refer pain into the spine. So it may not actually be the spine, but for example, patients with lower back pain can actually have hip problems. So we would actually also look at the hip joint to make sure that that's not a contributing factor. And then also similarly in the neck, it's good to look at the shoulder to make sure that that's not contributing to problems in the neck as well. The ultimate goal of the Houston Methodist Willowbrook Spine Center is to treat the patient. It's not to provide a treatment where the focus is on what the practitioner is good at. It's to really get down to what will benefit the patient. And by having a multidisciplinary approach, you're not just focused on what you primarily provide. You have a broad base of options to provide the patient with what they need the most.